I did obstetrics as part of my family practice for over 20 years. I was always amazed that the only time physicians actually recommended nutritional supplementation was when their female patients became pregnant. As physicians understood the need for supplementing their women patients with higher doses of folic acid even before they got pregnant to avoid what is referred to as neurotube defects in their babies, should they become pregnant. Physicians even began recommending supplementation if their patients were even considering trying to get pregnant. The problem has always been that almost all prenatal vitamins are based on what I call RDA levels, or those recommended dietary allowances, with the exception of the higher doses of folic acid they usually contain. However, most prescribed prenatal vitamins are woefully inadequate in providing the optimal levels of nutrition that are required for optimal health for the mother and the baby. In fact, in my original research for my first book, Bionutrition, I reviewed a clinical study from the University of Maryland that looked at 9 prescription prenatal vitamins. Now, they didn't look at how much nutritional supplementation was actually in the prenatal vitamin, but instead, they just looked to see if the capsule or tablets even dissolved. It really doesn't matter what is in your prenatal vitamin if it doesn't even dissolve. Well, only 3 of the 9 prescribed prenatal vitamins actually dissolved. This was really brought home to me when I realized that one of the prenatal vitamins that was tested and shown not to dissolve was one called Materna, which is manufactured by Lederle, a pharmaceutical company. This was the prenatal vitamin I have been recommending and prescribing for my patients for years. Well, recent research is now showing even more concerns. In the January 19, 2012 issue of JAMA, researchers looked at iodine supplementation during pregnancy. The body requires iodine to produce thyroid hormones. Dietary deficiencies has been estimated to affect nearly 2 billion people worldwide. However, dietary iodine requirements are actually increased during pregnancy due to increased thyroid production, increased loss of iodine through the kidneys, and fetal iodine requirements. When there's not enough dietary iodine intake during pregnancy, it can potentially lead to hypothyroidism, a goiter, and miscarriage in the mother. And in the baby can lead to goiter, cretinism or dwarfism, intellectual impairment, hypothyroidism, and even death in the baby. The World Health Organization believes that we need to have at least 150 micrograms of dietary iodine intake in non-pregnant adults. However, when someone becomes pregnant or is breastfeeding, they should be getting at least 200 to 300 micrograms of iodine daily. The problem is the fact that we are all getting less iodine in our diet because iodinated salt is on the decline and salt substitutes like sea salt do not contain any iodine. This has led the medical community to now recommend that if you are pregnant or breastfeeding, that you should ingest or take supplements that contain at least 150 micrograms of iodine. The problem is that most prenatal vitamins do not contain near this level. Another study, released in November of 2012 out of Germany, showed that vitamin D deficiency during the first trimester of pregnancy was linked with significantly increased risk of development of gestational diabetes during their pregnancy. This study showed that the low levels of vitamin D actually increased insulin resistance, which is the underlying cause of gestational diabetes. You see, the lower the vitamin D level was during the first trimester of their pregnancy, the greater the risk of developing gestational diabetes. Now, this low vitamin D level can increase a mother's risk of developing gestational diabetes by over 40%. These researchers are now recommending that any lady who is pregnant should be consuming prenatal vitamins that contain at least 1,000 to 2,000 IU of vitamin D. I personally feel that RX's Optimals are the ideal prenatal vitamin. First of all, RX Nutritionals follow what is referred to as USP guidelines so that you know that their capsules dissolve. They also contain 300 micrograms of iodine and 2,000 IU of vitamin D3, that most potent vitamin D. You are getting all of these essential nutrients at their optimal or advanced levels, which have been shown to provide a health benefit in our medical literature. Now, we are seeing studies like these that are showing why it is so important to be getting these optimal levels instead of RDA levels during pregnancy and breastfeeding.